Patients with cancer face two life-threatening diseases right now, one they already have and one that they're at risk for. So is one more important than the other, and how do the two impact each other? I'm joined by Dr. Peter Yu, the physician-in-chief for Hartford Healthcare Cancer Institute. Thank you for being with us, Doctor.
You're very welcome, Kara.
We've seen the numbers of COVID-19, and I'm wondering, does it increase the dangers for those who have cancer, especially with being immunocompromised?
Yes, if you think about most of us, we wake up every day worried about COVID. We go to sleep worrying about COVID, and in between, our lives are disrupted, all because the fear of a life-threatening disease. If you think about our cancer patients, that's their normal. That's what every day is like for them. They wake up worrying about a life-threatening disease that they do have. And now on top of that, you layer this risk of COVID. So you can imagine the tremendous stress for these folks. It's not like the rest of us where we can stop going to restaurants or stop going to church or school. Life has to continue for our cancer patients, and the treatments need to continue for these cancer patients. And that's a double threat to them, because COVID itself is more dangerous if you have cancer. If you have cancer, your immune system is already compromised. And if you add treatments which might even further weaken your immune system, it's really a double threat to them.
What can cancer patients and their doctors do to decrease the danger?
So it's really, there are things we can do, but it's really a new world for us. We have certain principles that we adhere to, that we discuss among ourselves, among our national colleagues, and even our colleagues in Italy in terms of how they've responded in the cancer setting. There are treatments that we are changing. So for example, most of the time, traditionally, we do surgery first to cut the cancer out, and then we follow it with chemotherapy or radiation therapy. There are times where we do give chemotherapy radiation first, but that up to now has not been the norm. Now with COVID, we realize that probably the most dangerous place to be is in the hospital, getting surgery and recovering. And so we are now flipping a lot of the treatments where we're giving radiation chemotherapy first to control the cancer, and then plan on doing surgery at a time when it's safer. Another example is radiation treatments. Traditionally, radiation treatments take maybe 5 or 6 weeks to give. The patient is coming in every day, exposed to an environment where there are sick people for 6 weeks at a time. There are alternative radiation techniques called hypofractionation, where treatments can be reduced to as short as 5 days. And so we're seeing more and more of this type of radiation to be used. And on chemotherapy, we're also making adjustments. There are changes in our scheduling so that we reduce the number of times the patient has to come into the office. Sometimes we can switch to oral medications instead of intravenous. And other times we can simplify the regimen to avoid some of the most dangerous drugs in terms of suppressing the immune system. So there are many things that we can do and are doing, really in discussion with the entire community of oncologists around the country and around the world.
Dr. Peter Yu, thank you so much, and our hearts and prayers go out certainly to your frontline staff and everyone who is struggling with cancer as well, with all the extra worry that goes with that.
You're very welcome, Kara.